what are the 13 steps of a lateral sinus lift? Step number 1, always a full thickness flap. How are you going to approach the lateral window? You need to expose the lateral sinus floor. You need to have a pretty large flap with a vertical releasing incision. You need to create your window outline. I created with a round diamond, just with an electric handpiece. Then I repeat this outline with a piezo surgery with a diamond tool, which I use my piezo tome for. So that's the finalize the window to the membrane. Then I elevate the membrane using sinus curettes. I separate from the floor and go all the way to the mesial, distal, and apical part, open it inwards, and lift it to the medial wall. If you don't lift it to the medial wall, you're going to have an issue. You're not going to be able to have a proper sinus lift. It's going to look like a great sinus lift, but it's going to be just halfway, and your implants may even be inside the sinus. So make sure that you lift it all the way to the medial. It's going to be very clear from the photos. Second, once you lifted the membrane, you tent it with a collagen plug or a gel foam. Keep it up there. Condense your bone. Again, here comes our bios. Once the bios is in there and you have condensed it with moderate force, you place a membrane on the window, collagen, Biomend Extend, and primary closure. Always Gore-Tex 50, 40, Gore-Tex 50 and GUT 4 and 50. 50 is actually meant for the vertical releasing incision. Okay, so this is the blueprint of the lateral sinus lift. I'm not expecting you to memorize it and understand how to do it right away, but if you look at the steps, what I'm emphasizing here is that there is a system here. So here's your lateral wall. Start your window about 2 millimeters above the floor. If you're starting your window too coronal, you're going to be going into the ridge. You're going to be ruining the ridge, and you're not going to enter the sinus. So you want to figure out where the sinus floor is, go about 1 millimeter up there, because the key to successful sinus lifting in a lateral approach is the window preparation. The better the window, the better the lifting. I don't want to say the larger the window, but you need to have a pretty large window or adequately large to be able to see. So you start about 1 to 2 millimeters above the sinus floor, because you don't want to drill into the floor. You want to take a look at the CT scan and make sure that you can visualize where the sinuses are and that you have a good outline. Again, it's going to be about 2 millimeters above the floor. You want to stay away from the adjacent teeth. You want to not to go too far back, but you want to have a good exposure. And I would say at least 10, 12 millimeters, 13, sometimes even 13, 14 millimeters in an apical direction. And this is where you create your outline with a round diamond until you see a dark hue. Then you complete it with a piezo surgery. There are great illustrations out there. I like this illustration because it shows a full thickness flap and it shows the window preparation in a cross section. And as you lift the window inwards, you are lifting the membrane, but don't forget, you need to keep lifting that membrane more into the medial wall. If you don't lift it into the medial wall, what's going to happen then? You're not going to have a good lift because you're lifting it only halfway. Here it is. So you're starting with your window preparation. Let's go here. Okay, so you're starting your window preparation. You're lifting the membrane. It goes up, but keep going here until you reach the medial wall of the sinus. You need to reach the medial wall of the sinus so this membrane is lifted. So when your implants go in from here later on, they're going to be in bone. Actually, in this example, it was probably enough, but you'll have more success if you go all the way to the medial wall. And when you start doing sinus lifting, it's going to make total sense to you. Okay, so I want to just emphasize this point. These are the tools that you need. There are different types of curettes. We go over this in our advanced training. There are different piezo surgery tips. I use the diamond one to create the window, and then I use one that looks like kind of a silver round one that separates the membrane, and the rest I do by hand. Okay, here's an example. We have 2 hopeless teeth. Once the teeth are extracted, here's your implant opportunity. If you don't lift the sinus, there's not going to be room for any implants, obviously. Here's my window preparation right on top of the CT scan. It takes a little bit of time to speak the language of CT to be able to see what you're seeing. I'm creating my window about 2 millimeters above the floor just to be safe. I don't want to create it too high up, because if it's too high up, then I have to find the floor, but I make it big enough so I can go laterally, and I can go all the way to the medial inside. And then in order to push it inwards, I actually used a PRF membrane to tent the actual membrane. You see this, what you're looking at here is the medial wall of the sinus. This is the medial wall. This is just tenting of the membrane with a PRF, but I went all the way in with my spoon curettes, and the key for that was a large enough window, going enough laterally, and separating the membrane, and walking along the floor of the sinus all the way to the medial part of the sinus. Now that you know the anatomy, I hope this is much more clear. Once this is tented up, I can now condense bone in there. Here's my BIOS, moderate force. I'm going to be placing a collagen membrane on top of it. It doesn't need to be fixated. You can just put it in there. The flap will hold it in place. If you want to add some, if you need to add some PRF plugs, that would be great as well. Michael, you can put me on a slide. I'm just going to finish this case. And here's the primary closure. Okay, I'm going to just refresh my presentation.